The framework is going to help us to give a consistent approach to each home and keep it safe. It's going to give us really clear guidance on what to do if we find something that isn't safe within the home. For example, making sure that we refer people for a safe and well visit so that we can get the right people into the home to make sure they get the right assessment in place. And that gives us the opportunity as a housing association to then make any changes that are needed.
So it's important we all work to the same overarching framework because we've all got a responsibility for safeguarding. And this gives us an opportunity for early intervention in people's homes and keep them living independently.
And if it's evident that there are problems within the home environment or the residential home setting that might indicate a fire risk, then we can advise them to use this framework and the associated tools in order to assess that risk and make onward referrals.
Some of the key points which do show people's vulnerabilities, which are all within this framework, is things to consider around if they're elderly, poor mobility, disabilities, mental health, smoke alarms not working, is the person a smoker, are they a drinker, emollient creams that individuals may be prescribed by the GP. It's actually a flammable chemical which also could pose a risk if there was a fire for that individual. That's something that we can consider within that framework to make sure that we are informing the safeguarding team about that.
So the person at risk fire risk assessment is a person-centred risk assessment which allows care providers and other agencies to identify the risks that these individuals are under and put in those control measures. Also, as a fire service, we're always there to engage and support with these decisions.
So we can use the framework in order to be really clear about what the vulnerabilities are for the person we're looking to speak to. So that might be the environment. We might notice that there's hoarding within the property. We also might notice this person has got some medical conditions that aren't being addressed. So therefore we can use the framework to help identify some of those key factors, but then also look at some of the key solutions.
The framework really just highlights the responsibility that we all have in health and social care and other partnership agencies